สวัสดีค่ะคุณหมอ
สวัสดีครับ
Thank you very much for joining me.
You're welcome.
Have you washed your hand?
Yes.
I shouldn't ask you.
Yes.
Yes. And thank you for your time for us because right now we can see you a lot nearly every day on daily briefing from the Ministry of Public Health. How have your life changed so far because of COVID-19?
Since New Year's Day, I have less and less sleep every day, I guess.
Yes. So it's the way to celebrate New Year.
It's the way to celebrate New
Yeah,
Year's.
with this outbreak of COVID-19. And I just report right now that we got the number of total cases around the world is beyond 200,000.
Yes.
Yeah. Has it beyond your imagination or it's something that we can predict that it will have come to this point?
I think I have been said for quite some time after we knew that it can spread from human to human. And when we start to learn that its basic reproductive number is quite very high, that is around 2 point something.
Yes.
I said that it's gonna be a global pandemic. And with this kind of spread, that it can spread very rapidly, I think it will go around the world very quickly, and every country that doesn't prepare very well will suffer from problem of trying to contain it.
Yes, but on the brighter side, we can see today, I heard the report from China that the new case is 0 today. So in a way, we can see how they have quite successful in terms of fighting COVID-19.
Yes. But you have to also learn that how strict the measures were. They kind of quarantine almost everybody in the affected areas.
Yes.
That is something that the scale of that measures I don't think we have ever seen before in the fight with any pandemic disease.
Yes. Regarding COVID-19, back to local situation in Thailand, I've been following the number of new cases. In the past 4 days, the total new number each day is more than 30.
More than 30 cases.
What does this tell us?
It's just spread faster. But most of the cases is still have the source that we identify. Most, not every cases. For example, at the moment we have problem with the cases coming from pub and nightclub.
Yes.
That is one place, and the other place that is from the boxing arena.
Yeah.
That is a big cluster, and there are a lot of patients that now going to different provinces. That we start to see the cases coming from rural areas, rural province.
Yes.
So at this time, the disease already spread further than Bangkok. We start to see cases here and there. So within Bangkok, the situation is one thing, but the situation in other provinces that they just start to have cases, their situation is different.
So the real number will spring up, will be shown.
What I try to
more.
say is that around the countries, the situation will not be the same. For example, in Bangkok, we start to see most of the cases were from Bangkok, but in some provinces, they never had a single case before. So in that province that never had a single case before, they are still in phase 1. What we used to say, they never have case. If they have case, it would be an imported case from somewhere in the countries.
Yes.
Probably from Bangkok. The case from Bangkok go there. Like you see the report in some provinces that they start to see cases like in Songkhla.
Right.
That was their very first cases, right? So the situation is not the same all around the countries. In Bangkok, the situation is one thing. We start to see local transmission, and the spread of local transmission is go wider and wider every day. The strategies that each province will implement will different. In other provinces, they still have to try to identify the cases as soon as they can and then try to contain it. In Bangkok we are doing that also.
Yes.
But if we have more and more cases, you can imagine that in the end we may not be able to trace every case. Then we have to shift our strategies.
Yes. So is it like a warning sign for many provinces around the country that they haven't got any one single case? They should be prepared as soon as they can, because it must. Can we say that they must be prepared for phase 1?
Yes, but in other provinces, if they are not well prepared, the situation will go very quickly. In Bangkok, we start our preparation since New Year's Day, as I mentioned earlier, around January 3rd. We have worked and we identified the imported case in January 8th, and then we have been trying to contain it from that day. We are very lucky, and I think we have, as a result of our hard work as well, that we were able to contain it until probably last week when we have a big cluster. So this is the situation of Bangkok, but the situation in other provinces may be different. They may go from imported cases to local transmission and to widespread of the disease within that province very quickly if they are not well prepared. So we have already talked about this kind of situation that it may happen for quite some times.
Yes.
It is not that we prepare just in Bangkok, we prepare every provinces in the countries. And hopefully by this time they should be well prepared for the situation.
And yesterday we see the announcement from the government that they like to, it's not national lockdown yet at this point. And the government said they encourage or have order to close down stadium, boxing stadium, restaurant, all the public activity, and told us to have less and less mobility. Is it at the right time to have this measure at this time? At the right
Of course,
point?
yes. To me, yes, I think it's a very good measure, and it's about time that we do it. One thing we may question is that is there anything else we could do? But I'm happy with what we have, what we got at least for now. But all of this is the government measures. We ask for collaboration in so many different fronts. For example, one of the measures that we ask is that can the workers within Bangkok, any occupation, private or public, could we start our work at different hours? So at the moment, most of our work hour, office hour, start from 8:30 or 9 o'clock until about 4:30 to 5 p.m. Could we start from 6 and end the day at about 2 or 3 p.m.? Or some may start from our office hour from 12 p.m. until about 8 p.m.
Do you mean government sector or every public and private sector?
Public and private.
To try to make different time slots of working hours.
Yes.
And how does this will help?
It will spread the people. Instead of having just rush hour of just about 1 or 2 hours, everybody's going to public transportation, go to SkyTrain or to underground train. You see that during the rush hour, our public transportation is so crowded.
And that's the risk.
That's the
most risk situation.
Right. So it is not just the government measures that will help our countries. It is everybody collaboration that will help the countries. Now we have to start to think of what we can do to help the situation.
Yes.
Not just what the government would do.
So it means that private sector can announce independently to try to have different shift of their employees.
Yes, or even work from home.
Yes.
Yes. For example, if we could reduce the workforce who have to go out every day to work down by 10, 20, 30% or even 50, 60%, that would be great. Not just for the private, but also for the public sectors.
Yes.
In the government sector, there are so many things that we can work from home. If we can do that, we will reduce the number of people going to going out from home. So that is what we call social distancing. That would be good for this situation at the moment.
Yes.
So
it's like how we sit at the moment. We try to
Right.
keep distance as well.
Right.
Is this enough for social distancing in normal situation?
Generally, just about 1 or 2 meters, that would be okay. Right. So the government is trying to what I would say to build the environment that we can live within this environment safely. But everybody else have to do their part as well, not just what the government can do.
Yes. People must be wondering, and this is like the ringing issue all over the country, I guess, especially when Prime Minister Prayut Chan-o-cha today that we need to step up measure and try to get ourselves prepared for phase 3 of COVID-19 outbreak. So what's the phase 3 and are we approaching it?
I think we are at the point that we are reaching that phase 3. Phase 3 we define it as having local transmission, sustain local transmission. That is the transmission of COVID-19 is spread within our local community and spread more widely and more people get infected. The main reason that we divided the epidemics or the outbreak into different phases because of the management of the situation as well. When the time that we have only imported cases, we will focus on trying to screen at the airport and do surveillance of the travelers because only the travelers are the one who could be infected, right? So when we start to have limited local transmission, what we would do is trying to identify all cases as soon as we can, went out to investigate, and then trying to identify the close contact, and then follow those close contact for 14 days to see if they have disease or not. If they have, so they will not spread the disease further. But when we approach phase 3, that is the disease spread all over the place, we could not trace the cases anymore. So we cannot do contact tracing that effective. So our strategy will change, even for the case management. If we approach phase 3, we will announce that not every cases need to come to the hospital. If you have only mild symptoms, you can stay home, take antipyretic drugs, paracetamol if you need it, you drink a lot of waters, and then trying to prevent yourself from spreading the disease to your family members. That is the management of case in phase 3.
Yes.
So this is from our standpoint, different stage of epidemics, we manage it differently. And the other thing is that it's also telling the publics how high the risk they are facing. During phase 1, they can see that no Thai is infected yet, so it is very safe to go outside. If they see the travelers, foreigners, they may choose to stay away. During phase 2, the risk is getting higher, but it's still manageable. But when they reach phase 3, they have to realize that every time that they go out of their home, there may be some high risk or small risk of themselves to contact the disease from someone who are Thai as well. But the risk will get higher or lower depending on how many cases we have within their areas, not within their countries.
Yes.
So let's say if we have 100 cases in Bangkok, it doesn't mean that the risk is the same in Mukdahan or somewhere else in the countries. So they can adjust what they should do. They can adjust how they can manage their risk of not trying to stay away from the infection.
Yes. So at the current stage that we are into in Bangkok, in other provinces, you emphasize again that it's different situation. But as of now, it seems the cluster of the infected case are in Bangkok. So what do you like to tell people in Bangkok? What should we do and how to protect ourselves?
At the moment, the measures or the interventions that we do change very rapidly. one thing that I would ask the Bangkokians to do is that they should follow the situation closely from the reliable source, instead of looking at the social media that share something that is not true. They should check the situation very well. By checking the situation, they should know what is their risk today and how they can adjust those risks. Number two, they should also follow the recommendation from the government of what they should do, what they should not do. And then the third, the most important things probably, they should learn the most important things. That is, learn what they should do and what they should not do, and bring that into their life and practice that. And so that they can, if they are not getting infected yet, so they can prevent not just themselves but also their family members of getting infection.
So what they should do, wash the hands.
Okay.
Yeah.
First thing first, they should, if they are not they are well and they are not infected yet, what they should do, number one, is they should try to avoid going outside, trying to avoid going into the crowded places. If they cannot avoid that, they should avoid anybody who cough, or sneezing. Stay away 1 meter or 2 meters. Number three, if they cannot avoid those situations, they should wear cloth mask. That's good enough. If they don't have to worry about the surgical mask. If they can get a hand on the cloth mask, that's good enough. Then they should wash their hand as frequent as they can, and avoid bringing their hand in to touch their face, eyes, nose, or mouth. Number five, they should eat the food well cooked, and then they should use the serving spoon of themselves. That should be enough, I think, to avoid the infection that they may risk in everyday life. Now, this is for the uninfected, and what is the recommendation for infected person? If they have common cold, like cough, fevers, malaise, or fatigue, whatever.
Just any kind of flu
or cold-like symptoms. If the symptom is mild, and if they don't have any history of exposure to the risk environment, like they never been to boxing stadium, if they have common cold, stay home and trying to prevent spreading the disease to anybody else.
No need to have medical checkup yet.
No.
Just ordinary flu.
Right.
Stay home first.
Stay home and trying to avoid prevent anybody from getting infection from you. That is probably the most important things. But if the symptoms get worse, they should go to the hospital. And when they plan to go out of the hospital, they should also plan to prevent others from getting infection as well. If they have masks, they should wear masks and go into the hospital with their alcohol gel so that they can wash hands properly. If they plan to stay home, they should think about staying in their rooms, not going outside, not having food with their family members. They should try to isolate themselves as much as they can. These things will help prevent your family members of getting the disease from you.
The doctor emphasized that we should wash our hands. So right now we can see many celebrities. For example, this guy, Alisson Becker from Liverpool, he has followed WHO director to have safe hand challenge. Let's take a look.
WHO, the safe hands challenge. So I try to follow the steps to clean my hands properly. your turn.
I didn't see the time, but it takes quite long, like perhaps 20 seconds.
20 seconds.
And do you wash your hand this way as well?
Not exactly, but
very much
thoroughly
detail.
as well.
Yes. So we have to try to do this as often as we can.
Yes, yes.
And regarding the work of the tough measure of medical staff, we can see how the medical doctor are working against time to race against COVID-19 in Thailand, in China, in many countries. What's the situation of the readiness of the number of beds in Thailand? Have you got information whether we have enough to cope with perhaps more patients, more cases?
There is one truth, that is, if we let the disease spread without control, there will be no countries that will have resource available for the situations. So, on one hand, we have to prepare the hospital. On the other hand, we have to try to slow down the spread of the disease as best as we can. Because if we do not do that, no matter how many beds we have, that will not be enough. Okay, so during this time we have to fight two wars. One war is trying to slow it down. On the other hand, another war that we are fighting is that we have to prepare our health facility, our hospital facility, as best as we can. Even before COVID-19, our hospital is already crowded. So what we are trying to do is we're trying to manage our bed as best as we can. If we have unnecessary operation or procedure that we have to do, we try to delay those. So I believe that for any countries we are going to have the same kind of plan, because no countries will have the bed for the situation like this. We are going to have enough our medical staff just for a normal routine work. So what we are doing at the moment is we are trying to make shift from routine operation into what we call emergency mode. The hospital will try to empty their ward as best as they can, so that they can prepare certain number of beds for the patients.
Yes. But in terms of the number of doctors, nurses, are we soon going to face shortage of supplies of medical staff in Thailand?
I hope not. Because we have so many sectors that can come in and help. Not just Ministry of Public Health, but several ministries also have large hospital, like Ministry of Higher Education, Ministry of Defense, and even Ministry of Interiors also have hospital or health facilities to help us. Or even private sectors. We have a lot of private hospital that now also taking care of the patient as well. So it is not only public sector that's work on this, as I mentioned earlier, but everybody is now doing their part to help the situation of their own countries.
For the case of pregnancy, perhaps the mother who are going to give birth and having pregnancy for a few months in their 5th month, how the risk of mother being infected and what's the risk of the baby?
The risk of mother get infected is not different from anybody in their areas. Okay, so if anybody have certain level of risk, she will have to face that risk as well. But the risk will depend on several things. Let's say if the pregnant woman want to reduce their risk, one of the best thing they can do is they are try to avoid going out of their home, try to limit the number of person she would meet every day. And then if she get infected, would there be problem of we would put her at higher risk? The answer is no. The high risk of getting severe disease will not include pregnant women.
Yes, but what's the risk of the baby being transmitted with being infected? If the mother got infected, we have just one. As far as I know, there is just one case report that the baby got infected from their mothers, so that is possible. Yeah, and all over the world, in perhaps people are wondering in terms of UK, perhaps you can give us some
Okay.
clue about herd immunity, in which the UK Prime Minister, he didn't say he will use it clearly, but it seems so. What does that mean, and does it work?
Generally, herd immunities mean that, let's say, usually one case can spread the disease to how many cases? Okay, let's give an example. For COVID-19, what we call basic reproductive number is around 2. Let's say let's have it 2 for the moment. It means that one infected person, on average, we can infect 2 more person. Okay, so at the beginning, when nobody's in our community are immune to the disease, so that one person can infect 2 person, right? So let's say if half of our population already immune, okay, it means that they could infect 2 person, but 1 person already immune, so that the disease could affect only 1 person. So when the disease go on and we have more and more people get infected, the basic reproductive number will drop. You keep dropping. And then when it reaches the point that the basic reproductive numbers is less than 1, the disease usually will slow down. Okay. So this is the effect of herd immunity. It is how many people who already immune that will slow down the epidemics. Okay. Now,
but it should take time, I guess.
it would take time, and
Yes.
it would take so many people
Yes.
that would be infected by the disease to stop the disease. If the basic reproductive number is equal to 2, the disease have to infect about half of the population before it slow down. For example, if in Thailand, if we let it go, it will infect at least 35 million people before it slow down.
That's quite a lot.
That's quite a lot. But the number of different countries will depending on the density of the population, and also depending on how good our health system are, and also depending on how collaborative our Thai people are as well. So different countries will suffer differently. It's depending on our unity of the countries. Are we all in this together to fight this war? If we are, I believe that we are going to be able to contain the disease in somewhat degrees.
Dr. Thanarak, I read from your Facebook, you said you've been through many challenges, this kind of tough situation, fighting against epidemic, from H1N1, from the flu, MERS, SARS, and until this one, COVID-19. Is this one the toughest
Yes.
from your experience?
Yes. Yes. When I was younger, I was like my first experience was SARS. During that time, our
That
work
was
is just
2002,
right.
2003.
We have about 10 plus or minus. That's our cases, and
Yes.
it doesn't take long before we contain it. MERS, we have 3 cases of MERS, but every case we were able to contain it. Avian influenza, I was still very young and don't have to take that much responsibilities, so it's fine. Although it's stressed a little bit, but fine.
Just a little bit.
Just a little bit.
But
But this one,
how
I
does
think
this one
my,
harm you? How this one affect you?
At this time and with my position at the moment, my responsibility is bigger, larger. So it's quite tough. There are a lot of tough decisions that we have to take, and what we do and what we not do.
Yes.
Sometimes when you are just a frontline workers, your decision may affect just 1 or 2 people. But now my decision may affect 60 million people, so I have to be careful with those decisions.
Yes, but we all shouldn't be disheartened, do we? And we can look at the bright side from South Korea, from China, and what can we learn from them in order to contain the outbreak?
There is one good thing about this kind of communicable diseases, and every day we can have hope. Let's give one good example. Let's say if our situation is getting bad, and we at today, for example, if we have 10,000 people infected, 10,000 cases, and if these 10,000 cases know what they have to do to stop the disease, if they stop spreading the disease in 14 days, we will have 0 case. Because if they stop spreading today, there will be no more cases, right? So actually, I'm not sure if we are fighting the virus or we are fighting the unknown. I mean, the unknown is Thai people don't know what they have to do. If they know, I believe that they want to stop the disease, the virus as well. So I believe personally that if we want to stop this disease, we have to inform every Thai people of what they should do if they come down with common cold. They don't have to care what infected them. What they have to care is they should stop the spreading of the disease. No more cases that will get the disease from them. If we can do that, no matter how bad the situations will be, we can always stop it at any times. So, is it hard? Yes, it is. But I think we still have hope, I think.
Yes. Thank you very much, Dr. Thanarak, คุณหมอ Thanarak, for joining us in English program.
You're welcome.
But we will carry on speaking in Thai as well because คุณหมอ is very busy. But to have him answering live in Thai, I think it's very important. So we'll have a pause, have a break right now, and let's take a look at what Arnold Schwarzenegger, who is Terminator, what advice he have to the public. Let's take a look.
See, the important thing is that you stay at home because there's a curfew now. Okay, no one is allowed out, especially someone that is like 72 years old. After you're 65, you're not allowed at the house anymore in California. So we stay home and we eat here, right? Oh yes, that's yummy. I eat with the whiskey and there's Lulu. Lulu loves carrots. Whiskey loves carrots. I just had my little bit of vegan food. Oh, that was yummy, huh? Oh, see, that's what we do. We don't go out, we don't go to restaurants, we don't do anything like that anymore here. We just eat with whiskey and with Lulu. We have a good time. We get entertained. Look at that beautiful smile she has, huh? Oh, yes. Oh, yes, the yummies, huh? And we have a good time eating here together. So much more fun than going outside. No more restaurants, okay? No more restaurants, forget all that. Public gatherings, restaurants, and all these gymnasiums out the window. We stay home. Okay, whiskey, huh? You, and I have you in my neck. Mwah. Yeah, whiskey. And you, I have you too. Now I have both of you. Look at this picture here. Yeah. No biting. Okay, you got to get along. Because we're in very small quarters. We have a very small house here. Yeah. Good girls. I love it.